Okay, we will call this the November Committee on Aging meeting to order. Bobby, would you call the roll? Oh, I'm backtracking. A little bit of etiquette that we need through this. Certainly limiting as much background noise. Make sure that you are muted through the meeting other than when you're speaking, and then when it's your turn, quickly unmute yourself. If you have a question or to be recognized, wave so that I can see you. Make sure that you public identify yourself prior to speaking, and all voting, all things as such will be done by roll call. And with that, roll please.
Sue Ashton.
Here.
Heidi Bassford-Kirchhoff.
Here.
Julie Kiefer.
Here.
Julie Davids. Ron
Julie is
Durkoff.
Here.
Zandy Kleckel is excused. Julie Maslowski is excused. Judy Ritchie.
here, and I just had a phone call from Julie Davids. She should be joining us very shortly.
And Deb Allison Osby is excused. Julie Davids is on now.
Judy,
Yes.
you were muted before.
Okay. I'm sorry. I'm having trouble seeing my screen from this distance. All that little. Okay. Are there any citizens' comments on the agenda? Bobby, did you get anything?
I did not.
Okay. Thank you. Then we will move on to the October minutes. Are there any additions, corrections, changes? If not, I'll accept a motion to approve.
So moved.
This is Julie. I'll second.
Okay. So we have a motion and a second. Any discussion? All right, then Bobby, call the roll, please. Bobby, would you call the roll, please, for that motion?
And you're muted.
Again.
No, you're muted.
Sue Ashton.
Here.
Heidi Bassford-Kirchhoff.
Aye.
Julie Kiefer.
Aye.
Julie Davids. Ron Durkoff.
Aye.
Judy Ritchie.
Aye.
Carried. All in favor.
Okay, moving forward, we have a presentation today on the prevention survey, and our speaker for the day, our next was the Aging and Disability Resource Center report on the age-friendly community, and that would be Bryn Seaman. Bryn on?
Good morning. This is Bryn from the Aging and Disability Resource Center in Winnebago County.
Can everybody hear me? Oh, good. I see lots of head nods and thumbs up. Very good. So my update is very brief. About the end of 2019, I began research and was able to pull together a small work group to focus on the age-friendly AARP network. And it worked out in perfect timing because Jean, too, had this initiative in her work with the Oshkosh Committee on Aging. So there's 5 of us, and along the way, we were able to gain a new member to our work group. And I'm sure in time, this work group will change along the way, adding folks as our goals call for it. But we were notified in October that with the City of Oshkosh Mayor's Office support and commitment letter and proclamation and the submission of our application, that Oshkosh and surrounding area community has been granted membership to the National and Global AARP Age-Friendly Network. So this is a very big accomplishment, but also the beginning of a lot of really good work. This opportunity allows us to highlight the great work that's already been done in our city and our county, and then be able to build upon that. So the tentative timeline is that beginning in 2021, we'll have the more large-scale press release with AARP. Our work group will be really working extensively with social media outlets, other media platforms to share information about the age-friendly commitment and community, so that come hopefully about March time of 2021, we'll be able to initiate the community survey through AARP and hopefully garner hundreds of community feedback information to help develop our community action plan moving forward. The timeline for all of this work to be done is about 2 years in gathering and capturing the information and creating a plan, with approximately 3 years to help build upon the plan and begin to accomplish some of the work set out toward the goals in those plans. So it's about 5 years altogether. And I think that's the update, unless anybody else has anything they'd like to add or ask questions.
This is Heidi. I've got a question. Have we been having meetings? Have we been having meetings and I just haven't been able to receive notifications, or what have we been doing as a subcommittee?
I apologize. I will make sure that you get the next one. So much of what we've been doing as a subcommittee is all of what I had explained. So it was the work on the application, several reviews, contact with the mayor's office, submitting to AARP. We did have one initial meeting with them thus far. Got some tentative timelines and dates. We're able to get some questions answered. And then our first of monthly routine meetings for that work group begins in November. So I'll make sure that you're invited. My apologies.
Thank you.
Does anyone else have any questions or comments on that?
Judy, this is Ron. I have a technical question here. It appears that all of you are, well, some of you are live, some of you are pretty stationary, and the volume or the speaking is breaking up. Is it advisable, Ray, that I reboot, or what would you suggest? It appears on my picture that it's buffering. And I don't know if others are having that problem, but Sue is moving around, Judy moves around, but Jean and Julie are pretty fixed. I don't think that's probably the case.
Ron, that's probably your internet connection, and there's really not a whole lot you can do except struggle through it, and then you'll have to work with your provider to find out how to strengthen your Wi-Fi connection.
Okay, it hasn't been a problem in the past on Zoom meetings and so forth, so that's why I was wondering if that's something I should just reboot this meeting, or can you hear me okay? Because,
Yes.
okay. Okay. Thank you.
The challenges of technology. Okay, then moving on, we'll have Jennifer Scholaski from the Community Nonprofit Leadership Consulting Group and reporting on the Falls Prevention Survey or the Steering Committee project. Welcome.
Thank you. It sounds like Ron is seeing a dance party with how many people are moving. All right. Well, thank you so much for having us. When Judy asked me to present in March, I said it was too soon. And now I worry it's too late. So hopefully I didn't forget too much of the information. We had a really great group working on this and a lot of the partners that are around the table here. So I'm going to kind of go through what the project was and some of the results. And then hopefully there's some questions as well, or maybe even some feedback from partners that were involved. So we called this project the Fall Prevention for an Aging Population. All right, next slide, please. So a little background, we were able to receive some funding from the Basic Needs Giving Partnership, which is supported by the Venture Fund for Basic Needs within the Oshkosh Area Community Foundation and the J.J. Keller Foundation, making sure that we thank all of our funders that supported us. And the main reason that we put together this project, and I know that you had Chief Stanley talk to this group, I believe, a while ago, but he had come to me and he had said, hey, the falls are out of control in our community. In looking at the fire department's data, so many people are falling. We're worried about deaths, and looking at national research, we know that falls are a huge issue. And so we wanted to look at what the root causes of falls were in our community. So to get around this, we conducted research in a lot of different ways. We conducted community conversations, and I'll kind of get into more details, and then surveys as well. And we were looking at Oshkosh residents, older adults, service providers who meet the needs of older adults, and community change agents. Next slide, please. So here are our main partners that were part of the steering team. Like I said, some of you are around this table, which I'm really excited to see. But we had a wide variety of partners. So from city to county services, from Evergreen, the senior center, the YMCA, housing authority, obviously the fire department. And then we also had some volunteers, some community volunteers who've been involved with the community a long time and really wanted their feedback as well. Next slide, please. So this is the data of what we were able to do, and we actually did a heck of a lot in a short amount of time. So we had 18 community conversations between November 11th and December 13th. 13 of those sessions were with users of services. So we went to places like the YMCA, to the senior center. We went to Evergreen. We went to other senior living apartments. We went to public places where we sent out, advertising in the newspaper, trying to get people to come. So tried to get a variety of people and really a diverse group of people. We also did some sessions with service providers. We knew that we weren't going to be able to get all of the service providers at, a lunchtime session. So we made sure to do surveys to collect their data. And then we did two sessions with community change agents. And those are people in the community that help make decisions. So some of it's funders, some of it was city and county people, some people who own businesses, trying to get their perspective on things. Like I said, we also sent out surveys. So each community conversation we also had a hard copy survey where we'd ask them further questions about falls or risks for falls or what they wanted to see in the community. We also sent out that Survey Monkey to service providers. Like I said, we couldn't get everyone at a lunchtime. Not everyone could miss work, but we were able to get a lot of feedback, 228 responses from them. We also did a Polco survey from the city of Oshkosh. So we wanted it really broad to see what people thought. Along with this grant that we had gotten, we also tested 3 pilots during that time. So we did a follow-up mailer, which was between the Winnebago County Health Department and the fire department. a new track app, and rebuilding together Fox Valley. So we were trying 3 different ways of engaging older adults and preventing falls to see what would happen. We also wanted some real-time data that we got from the fire department and also from the coroner's office. So we looked at the cases where people had fallen and had died and wanted to know where they had fallen, were there other health issues, trying to get a little bit more background on those. Next slide, please. So the 3 big questions we asked, and if you have questions, feel free to interrupt me at any time. But the number 1 was, what community resources or things in your community do you use to stay physically and emotionally healthy? We really wanted to know, hey, what are you doing that works and that our community offers? The second one was, why do you think people fall? So not why do people fall, but why do you think? Or talking about challenges in our community. We also wanted to make sure that we said, feel free to share your experience or the experience of friends, because a lot of people didn't want to talk about their own experiences with falling, but we're happy to talk about a neighbor or friend or family member. And then the third one was, what as a community could we do to help reduce the risk of falling? So this was like the big thing, right? What can our community do to change these numbers? And it was really exciting, some of the ideas that came back. Next slide, please. So here are our findings. Next slide. Making Anne work so hard. So these were the main themes that came out of it. So the first one is, exercise is how older adults report staying physically healthy. When we asked that first question, we heard a range of things that people are doing in terms of exercise. Some of it was walking, whether it was indoors or outdoors, some strength training. We heard silver sneakers. We heard a lot of, Tai Chi, the programs that the Senior Center, the YMCA, that Evergreen are offering. We heard that. We also heard about group activities and one-on-one relationships are how older adults stay emotionally connected. So, I know that a lot of people on this call are working on social connectedness, and this was the theme that went right to it. People talked about learning in retirement. They talked about, the Retired Old Men Eat Out, the Romeo group. We heard a lot about faith communities, that a lot of people are involved in their faith communities to stay with that connection. We also heard about neighbors checking on neighbors. We heard about happy hours. We heard about a lot of things. And I'd be curious about how this research would look different now, since COVID has happened and people are more socially isolated, if this theme would still come up or even be more pronounced. We heard that falls are caused by both external physical factors and personal health factors. So in terms of the external physical conditions, some of it is like the outdoor weather and uneven surfaces. People talked about parking lots being tricky or sidewalks. But we also heard about indoor, and this is really where is a key finding. But people are falling because of inside their homes. So whether it's the bathroom and not having a handrail in the shower, we heard about rugs, we heard about pets, we heard about not having enough lights in their house, especially when it gets dark and you have to get up and go to the bathroom. We also heard about personal health factors. So as you get older, sometimes you lose your stability, which is why some of those exercise classes are so focused on strength. We heard about, overuse of alcohol, that being in Wisconsin, we know that a lot of people like to have their glass of wine or their old fashioned. And sometimes that can also cause falls. Fear and stigma among older adults was noted as major barriers to fall prevention. This was huge. And I think a lot of people are thinking, well, fear and stigma, fear of falling, but it wasn't just that. It was fear of losing one's independence or fear of losing one's home. There was a lot of misconceptions about, I'm worried that if I fall and my doctor, reports me, I'm going to lose my home, that I'm going to lose this independence. I'm not going to be able to drive. So fear and stigma and stubbornness came up in all of our conversations. We heard that education about fall prevention is so important. Some people didn't know what constituted as a fall. If you trip and you're on your bed, or you can't get out of bed, is that a fall? Or you can't get out of your chair. So some education about that, but also what the risks are, and at an early age. It's not just that you're at 110 years old and you're falling. That falls can happen at any age. Teenagers. I have a toddler. He's falling all the time. I'm trying to tell him some of these skills too. But I think about the importance of strength training as we get older as well. But also what resources are out in our community that can help us. Intergenerational engagement in order to combat ageism. And I'm assuming that this is something that this group works on a lot, but combating ageism is very necessary. We heard from a lot of people, I don't want to share this with my doctor. I don't want to share this with my, 70-year-old kid because they're going to judge me. And there is a sense that since I'm older, I can't do it on my own. And so thinking about ways that our community can support older people or older adults and show the value and how we can connect intergenerationally as well. And then increasing trust between older adults and formal authorities. So I kind of hit on it with the fear and stigma. But I think that this was another thing that, once again, people are afraid of losing their independence, whether it's their home, their right to drive, thinking that people think that they can't take care of themselves. But working with them and social service agencies or county services. We heard that a lot of people don't trust people coming into their home because they're worried so much that they're going to lose their home, even if it's a public health nurse, even if it's a home health agency, even if it's a senior center or the fire department. So looking at all the different ways that we can connect and support older adults. Next slide, please. So our main target, we wanted, we have goals and an action plan, which I'll get into, but our main finding, and I'm so glad that Jean is on the call here. And can you go to the next slide? Because Jean came up with this, and I was going to give her major kudos, and now I can give her major kudos and see her face with it as well. But she came up with this, and I love this. So our main target is Fiona Falldown. And Fiona is a 70-year-old a woman. She lives, by herself. She may have a spouse. She lives in her private residence, and she falls in her home and she struggles with general weakness. And the thing that we heard is there are a lot of people, especially 70-year-old women, that are healthy and that are active. But sometimes we think that we can do things that we can't anymore. So Jean put this together and I love it. Jean, would you mind if I didn't even tell you about this because I didn't know you were going to be on the call? Could you unmute yourself and just say a couple of words about this if you feel comfortable?
No, you're doing a good job, Jennifer. Thank you.
Oh, good.
This was just put together from the findings that we had gotten out of this study. It could be an easy handout or a poster of some sort, is just kind of an idea, because these are just our key points of what we found out of that study. So each one of those boxes is actually the education that we need to get out to people regarding the falls prevention. So.
Awesome. Thank you, Jean. And I think, the thing that I like about this, and the Herald did an article on our work, and my quote was, "Get rid of your rugs," which I thought that was funny, that was the major takeaway. But I think, that is a major takeaway, that, get rid of your rugs because it's a tripping hazard. And I'm trying to find, and I know all of our partners were trying to find, what are simple things that older adults can do in their home to protect themselves, even during this crazy time, during a pandemic? And it's eating healthy. It's making sure that you have those grab bars in your house to protect yourself from falls inside. It's making sure that you're still seeing your doctor. So that you can keep healthy, especially your vision and your hearing. Those were huge things. Making sure you have proper lights. I already talked about the rugs. Making sure to exercise. And the thing that I love about the exercise, it's not only to keep you physically healthy, but mentally healthy. And that's what we heard from so many of the people in the community conversations, is you have to keep that exercise going, even when you don't want to, or even when it's really cold in Wisconsin in the winter. Contacting those agencies that are out there, like Aging and Resource Center, or the Senior Center, or the health departments, and then also proper shoes. And so we were trying to come up with creative ways to get the community involved, which goes to our next slide, please, Ian. So this is really, our group came together, and luckily enough, this happened right before, the pandemic was in full force. But we were able to have a half-day session to just go through all the results and say, okay, what do we as a community need to prioritize? Next slide, please. So we decided that our main goal, which, kind of addresses the root cause, is our overall objective is to prevent falls among older adults by taking action on community partner-driven recommendations. So based on the research and what our community already has capacity to do, we want to know what we can do. to prevent falls. So the 3 prioritized recommendations are: 1, reduce falls in the greater Oshkosh community; 2, to educate individuals, families, and the community on falls; 3, build relationships and trust through community connections. So through all the themes that I shared with you, these were the top 3 that we heard from our partners need to happen and need to be addressed. I hope you also like the picture of the fall from the sky as well. I thought that was kind of funny. All right, next slide, please. So just to go into this a little bit more, so you know what we're talking about. So reducing falls in the greater Oshkosh community. Obviously we can look at, how many calls the fire department is getting in terms of falls. And I know Chief Stanley will be on the call later and he can talk about how this has changed during COVID. But also thinking about, the prevention piece, increase those fall prevention programs and projects, or just advertising them and making sure that people know about them. We have a lot of really creative ideas, and I don't necessarily want to share them right now because since COVID has hit, some of the work has been stalled, but I also know that partners have been able to continue some of the initiatives, and I'm really not sure of what those are since I haven't been working on this project for a while. But just know that I know our community partners are still taking this as a priority. Next slide, please. So in terms of education, and this is huge. We talked about, doing a PSA of ageism, what you can do as an older adult, and how you transform from being a young kid to being an older adult, and all the skills and talents you have. But also talking about how falls can happen at any age. But making sure that we do this through a lot of formats. We talked about even the fall prevention education not being for the individuals themselves, but their family members. We heard from some of the service providers talking about their own parents, them being caregivers and saying, hey, I checked on my parent at Thanksgiving, hadn't seen them in a while. They were in really bad shape and I had no idea. So some of this fall prevention also has to target the people that are taking care of older adults, making sure that they know what to watch for, what to get the individual involved in terms of classes, also just all the resources involved. Next slide, please. So then the last thing, and this, like I said, really came up a lot about, older adults being so afraid of losing their independence and losing their homes, but also this stubbornness. As we get older, I know we get more stubborn, and I can't imagine what I'm going to be like because I'm already stubborn. But thinking about I don't want to change, I've always been able to do this, so I should still be able to do this. But thinking about what are those tasks that you can delegate, and part of this is building that trust and building those relationships. We, in the city of Oshkosh and in Winnebago County have such amazing services for older adults. But we have to keep building relationships with older adults so that they trust what we're doing, that they can go into the senior center and feel good about the staff that they're working with and not fear that they're losing their independence or that they're losing their home. That they feel comfortable talking to their medical provider. If they don't feel comfortable with their doctor, there are plenty of doctors and NPs and PAs out there that they can work with, but making sure that they take care of themselves and their own health. We heard from people saying, I won't report a fall because I don't want to get reported on, and lose my home. Well, if they're not telling their doctor that they're falling, who are they telling? And we know that once you fall, you're going to keep on falling unless you change something. So as a community, we really need to work on building those relationships and trust between older adults and our community agencies. Next slide, please. So in conclusion, like I said, we had so many wonderful partners at the table. We learned so much great information, lots of really great ideas. And even though COVID hit and even though, our world is disrupted right now, I know that there's a lot of good work going on and that we'll keep doing it within the next year to 2 years so that we really see a change in this area. So that's all I had. Were there any questions?
I'm wondering who is doing some of the community education.
Yeah. Anne or Jean, do you guys want to talk about what the senior center is doing?
I think right now, Julie, we did have to kind of put the brakes on this for a bit, but we did start up actually this week. We are running a stepping on class, which is a falls prevention class. And that is with only 8 individuals. So before it was a number of individuals, I believe up to almost 20, but now they limited it to 8. So, and we are just starting our indoor exercise classes with a very limited amount of people. So it's a slow start to get back into this falls prevention, but we're taking it one day at a time.
And I know Chief Stanley can probably talk more about what the fire department's doing, but I also do know that some of our partner agencies are applying for funding so that they can start working on some of these action items. So I know Rebuilding Together is trying to do more installations of grab bars. That was one of the pilots that we did, and we saw some success of it, you know, even limited, that installing 5 grab bars can make a difference in someone's life. So once again, some of this work has yet to be done, but I feel good that partners are still prioritizing this.
Jennifer, do the partners get together occasionally to or networking?
I would leave that up to the partners. Like I said, the timing of this could not have been any worse. That we had all this momentum and energy for this action plan, and then COVID hits, and everyone's work is different. You know, I work with the health department on a lot of different things, and their work has totally changed. I know with the senior center, since you guys are on, I keep picking on you. I know their work has totally changed as well, and what's a priority. But maybe Chief Stanley, are you on the line? Oh, he just texted I'm on. So you want to address that?
Absolutely. You know, I tried to capture a couple of the questions that already got asked. You know, more than everybody. Let me turn on my camera here. Thanks for having me on. I hope everybody's having a great morning. That, you know, will dovetail off of what Jennifer was talking about and some of the questions that you had. That, you know, there still are some of the programs operating out there, you know, as Jean talked about, the senior centers doing their part, you know, and starting to get back to more and more programming. You know, there's programming that's still happening from the individual, you know, senior living facilities, you know, that are doing that internally. You know, the health department, you know, they might be just a tad bit distracted and shorthanded right now. So, you know, for the past several months, so they haven't been able to do some of their education and outreach. But, you know, the YMCA is, you know, back to their programming. So we're seeing a start to get back in there. You know, in questions in response to your question, sir, are the partners still talking? We are. You know, obviously, you know, we're not as comfortable as we once were, being able to meet face to face and really discuss some of these issues and get together. You know, that we're all subject to meetings like this. You know, and as Jennifer said, distracted, but a lot of good things going on yet. That we continue to work with Oshkosh Media to get some of that messaging out, you know, develop some of those PSAs and messaging around falls. You know, we continue to very closely track data in the fire department. You know, one of the questions that I got asked to discuss on today's call is how has COVID or the, you know, current state of affairs affected the fire department's run volume and specifically falls. So initially we saw, you know, which is very common, you know, across this area, our call volume went down quite a bit. You know, that everybody's, you know, during the stay-at-home order, everybody locked down. Nobody wanted to go to the hospital. Nobody wanted to interact with anybody. Our calls went down about 17%. You know, so that didn't last long. You know, they bounced right back up. You know, and now they're running our norm to high. You know, above our baseline. One interesting phenomenon, even as we saw the call volume go down, we saw the falls go up. You know, so we're traditionally run a very, very disproportional percentage of fall calls, but, you know, that continues to rise and mount. You know, lots of theories about why, you know, because people are in their home, you know, they're not out and about, they're more likely to fall in their home. Sure, but is it because they aren't as active? They weren't able to take part in activities, going on, walks with their neighbors, or informal things to more formal structured programming like the YMCA had. So is there, or the senior center has. So is there a degradation? Are they any progress they've made or maintained with their physical activity? Is that eroding? And are they losing that core strength? Is it they're not following up because with healthcare, because of the limitations that were around that, they're not getting checkups, getting medications adjusted, getting eye appointments to make sure that their prescription is correct. I mean, there's lots of different things we could theorize, but we saw the falls increase. And that's the exact opposite, obviously, of where we want that direction to go. But Jennifer did a fantastic job of kind of capturing all the work that went into that research. But one of the recommendations that came out of that is a Mugs for Rugs campaign. I heard her talk about get rid of your rugs. Decorative throw rugs, are the bane of many people's existence. That causes their fall. That may result in a traumatic injury. They have to be hospitalized. And the downward spiral begins. So we came up with the idea, and the recommendation through that program Jennifer orchestrated, that we would partner with local businesses, businesses where seniors go to. Jennifer mentioned the Romeo Group is one example, where if you bring in your throw rug, we'll give you a coffee cup. And anytime you bring that coffee cup to that one of the partner businesses, you get a free cup of coffee. We think that has multiple benefits. One, obviously, it gets rid of the rug. It gets you to take up the rug. Jennifer, I heard her talk about isolation. And I know what a prominent issue that is. If you've been reading the articles in the Herald lately, social isolation is a big problem. So we want them to get together and be able to interact. Make them leave the house to go turn in that rug and get the mug. So they have to be mobile. And clearly an ancillary benefit of this is stimulate local business. That's our restaurants and coffee shops and things of that nature are certainly struggling immensely through this time. So we're working with the Convention and Visitors Bureau right now through them to reach out to some of our local restaurants and coffee shops and diners, reaching out to get the mugs printed. We've requested some funding from the Oshkosh Area Community Foundation specific for that program to try to get that started. So that's our next big step. So I know that was a lot of whirlwind words. I think I'd rather open it up to any questions you'd have.
Can I just say one thing? I think the tagline of decorative rugs, the bane of your existence. I think that's a really great tagline. I just want to say one more thing, Julie. I keep thinking about your question about what's being done with education. And I think one other thing, the reason why this is so important is that we start getting the word out about falls. And so if there's anything that you take with you, know that, from our results, some falls may happen outside, but it's mostly inside your home. So think about Fiona fall down. And I think sharing that message and what can be done in the community resources is a huge part of that education.
So I guess I'm asking because I work with the Learning and Retirement Group. We're doing virtual programming. I'd love to have someone come speak. So I guess I'm not sure who to ask. I guess that was my question. Who can come and speak to a group about this?
I'm happy to share about our project, but I think if you have one of the other partners there as well, talking about the work that's being done, that's probably even more influential.
And I'd be happy to do that as well.
Jennifer?
Yes.
Hello, this is Brian Nagler. I'm from the ADRC program.
Hi, Brian.
How are you? I'm sorry
Good.
this is my first foray into this platform, so I couldn't get my video to work, so I apologize. But just to kind of explain, because we are certainly one of those partners, just for those that don't know, when the fire department has falls calls, is what we call them, they are trying with all their might to be able to make a referral to us at the ADRC. So when you talk about education, we're trying to do that on an individual basis. I keep track of the referrals that we do get from the fire department, and since the inception of this program, we've had 99 of these falls referrals to our ADRC, and I think that's a beautiful thing to celebrate. We have had connections that maybe we wouldn't have had. I keep track of whether that person that we get that referral on is new to the ADRC or if we've had some experience with them. So we've made some inroads in the way of some short-term case management and some problem solving with people. So I think we're educating on that point, but point absolutely well taken about the stigma. It's something that we experience on a good day at the ADRC. But when people fall, we do get the referrals in a timely manner. Many of our follow-ups to them go unanswered. I think they're ripe for maybe changing their life when the fire department is in their house. And then when they leave, it goes back to those past practices. They're scared that we're coming in to basically put them in a nursing home. I think that's what a lot of our populace thinks, and that's just not at all the case. So we try to educate as we can. We've had some serious successes to this, though, too. Not many, but a good many of those calls, they decline our contact. But we are referring to the public health, to the falls prevention, for the assessments, and we are working with people. We've done APS, Adult Protective Services referrals, so that people with dementia can work towards guardianship or a decision maker. We've worked with Larson Winchester Alliance to be able to get durable medical equipment that people need in a timely fashion. We've sent them out, the more able-bodied folks that can travel, and this was kind of before COVID, go out there to shop to the Larson Winchester Lions Club. But referring people to dementia support groups that are in a caregiving mode, trying to relieve that stress. We've built ramps. We talk to people about our local caregiver programs here at the ADRC that can help to keep informal caregiving systems moving and going and free of caregiver stress and burnout. So we're trying to educate as we can. Just as Chief said, we're welcoming, you probably at this point, virtual meetings. We would have to educate people, but we do go out and outreach into the community. It's going well, but I do think for the programs, speaking for the program, I think there's room for improvement. As far as us, my perspective on it is that, and this is tough in a COVID time, we could do a little bit more getting together as partner agencies to discuss where we're at. I think Chief has data, we have data, putting those together to understand where we're having success and where we could maybe beef up the program a little bit, because this is just a starting point. And look, we have 99 referrals, and that's amazing. But this program can grow like crazy in our community and help a lot of people. So just wanted to put that out there. I'm here for questions as well. So if anyone has any, by all means, I'm going to mute myself again and let the group ask questions if they have them. Thank you.
And I think that one thing with what Brian's talking about too is, as part of one of the pilots, there was the app to connect, you have a fall, connect you to ADRC, connect you to the health department for that follow-up. And one thing that was really good was that warm handoff. And I think that that was a huge piece. If you fall and someone says, you should do this, well, where do you find it? And so I think the ADRC did a great job of connecting with people and getting them into the programs that they need or into the housing support that they need. And we definitely need more outreach from agencies to be doing that.
This is Ron. I have a question for Brian. Have you been able to involve the family very much in some of those calls, your fall calls you're getting, where you can try and sort of mobilize the family to help sell the message that you're not there to get their relative into a nursing home. You're there to make it possible for them to remain in their own home as long as they possibly can, as long as they want to.
Yeah, we'll utilize anything available to us. So if there is family that's involved and that person will allow us to have them in, we're going to utilize them to the best extent possible to be able to help have them make an informed decision. That our staff is kind of programmed for that, Ron. You probably remember that.
Right.
That's the stigma around social services in general. So anytime we can pull in kind of corroborating people to make that person know that, but those are deep-seated thoughts about, you know, I think this group of elderly in particular that are falling, you know, there weren't many options for maybe their loved ones that they watched once upon a time other than a nursing home. And it's explaining them, and it's the struggle of the ADRC in general. We're always out trying to beat the bushes and have people understand what we are and that we're here to help. You know, whether it's a small thing, it keeps you potentially in your home longer. That grab bar in the bathtub, or whatever it might be. It's coming from that place in all of our actions. But again, we're kind of hamstrung a little bit right now with COVID. Our best foot forward is to be at the kitchen table and have that discussion in person, eyeball to eyeball. And when you can only do that, you know, it's a blessing if we could do it virtually, but most times it's just over the phone or via email, and that's just so impersonal. It's not necessarily where we want to be, but it's what we've been dealt right now. So I think this whole system struggles a little bit because of our goofy COVID that's going around here. So.
And Ron, one piece that we did find through our study is a lot of people mention about power of attorney. And that actually, I heard it loud and clear from Chief Stanley's staff, that a lot of them are put in uncomfortable positions trying to find the power of attorney or making decisions based on, you know, the individuals asking and family not being involved, especially in some of those senior living places. So making sure to have that conversation as well. And maybe that's, you know, something that happens much earlier on. And as part of that, fall education also becomes part of it.
Right. Yeah, thank you.
Jennifer, in the middle of all of this, you nominated Chief Stanley for award. Do you want to talk about that, please?
Definitely. So, and look, he even has a smile on his face because of it. That's something important because that doesn't happen very often. So I nominated Chief Stanley for the Hero Award from the National Fallen Fighters Foundation and Meg Light. And, you know, the Hero Award was for a firefighter who goes beyond the job and who does community work. And I nominated Chief Stanley because he's doing a lot of incredible community work. I'm not just working on this project with him, but stuff around overdoses and substance use as well. But I was really impressed that he saw the data, you know, and being early on in his career in Oshkosh, and being, you know, new to the community, looking at the data and saying, we have to change this. And obviously, you know, he's got a much bigger role with COVID now. So the fact that he's even talking about this and still trying to move forward on this, even though he's, you know, in charge of it all. So blame him. No, I'm just kidding. So I nominated him because I was just so impressed with his work in trying to change and move the needle in the community.
Well, thank you for doing it, and congratulations, Chief. All of us have been so excited to hear that, and really makes us feel good at the job that we're all doing and working together. Collaboration is the name of the game, rather than each of us going our separate paths and trying to make it all work. So.
And Judy, the one thing I'll say is, since I was able to go, you know, for the award ceremony, and I'm sure it's recorded somewhere, but his speech was very, very humble and talking about how the award was not for him, but for the community and all the partners that were working on this. I mean, I know he'd say that now, but I had to take the words out of his mouth.
Yeah, thank you, Jennifer, and thank you, everybody. And Jennifer's right, you know, that I did say that, and that was very heartfelt. I don't think that one person can take any credit for what we're doing around fall prevention. You know, it's the things that all of us are doing. You know, the work that this group is doing, the senior center, the YMCA, you know, ADRC, all of our different partners, that work together, said, we see a problem in our community, and as a community, we're going to address and solve that problem. So I'm very appreciative that I was able to come to a community and work with so many people that are enthusiastic and passionate and give their time and their energy and their love to make a difference. So thanks to all of you.
Well, again, thank you. I have a question for you, because I live in a 55 and up building. We see your staff with some frequency, and one of the comments that I get, not that I see people often, but when I do, is why, when your guys come, are they all of a sudden suited up in full protective gear, not coming in with just their gloves on like they used to?
Sure. That's another word for protective equipment is universal precautions. That we always, like you said, have worn gloves because, the assumption was everybody had a communicable disease. And what we were experiencing is a lot of after the fact knowledge about exposures. So, we would get called because somebody slammed their hand in the door. So we think, oh, okay, that's not a COVID call. We'd go, we'd treat them, then, wouldn't take all those extreme protective measures that you're seeing now. And then we'd find out, well, by the way, they also had COVID in addition to slamming their hand in the door, and your crews just got exposed. Exposures like that, as we get to those moderate and severe exposure levels, necessitate that person then being put in 14 days of quarantine, so that they don't expose the rest of the workforce. So it was dramatically impacting our workforce, generating a lot of overtime, a lot of forced overtime, expensive to the taxpayer. So I made the decision of we're going to put everybody in that protective equipment from the beginning. Just assume that everybody's got COVID, and that way we don't regret that we weren't as safe as we might have been after the fact. So that's the change. We've made several other changes that, individuals will see, like you said, Judy, you see them traipsing through the building dressed that way. But, on calls where we suspect COVID or know there's COVID there, normally everybody comes in on the crew, everybody comes into the house or into the apartment. We just put one or two people in there, as necessary to try to limit exposure. So, we've really done a lot around trying to protect the workforce, protect our fire and paramedic people, as well as, protect the public. We've certainly had cases, just like everybody has, where, their spouse or their kids got it and transferred to them and they didn't know about it. We don't want to spread that out into the people we serve either. So, that's why everybody's, gowned and masked and goggled and gloved, and so that, we can try to arrest the spread.
Oops.
I don't know if I bored everybody to sleep. Or any other questions that I can answer, or Jennifer or Brian?
Chief, I think you did a great job. Thank you so much. And congratulations again.
Thanks, Gene. Thanks for having me on the call.
I guess I'd like to echo what Gene is saying. This whole project and addressing falls in the city of Oshkosh, I think is really critically important. It's been an issue for a long, long time, and I'm just proud of the fact that the partners have come together, and I just hope that the effort can continue in spite of COVID and really shine once COVID diminishes. So thank you all.
Thanks for having me on. Have a good day and go vote.
Thanks, everybody.
Thank you.
Judy, I lost your face, but oh, there you are again.
Okay, she's back again. She was off. Judy, can you talk?
I can't see anything and can you hear me?
Yes,
Yeah.
but you're buffering quite a bit, so maybe Jean or Ron could continue the meeting agenda.
Sure.
Ron has
Judy-
to.
Ron, go ahead, Ron.
Judy, just so you know, Judy, what worked for me was actually to leave the meeting and then come back in, and the video and the speech was not breaking up and the buffering ended. So you might want to try that. In the meantime, I'll go on to the final part of the meeting here. We don't have any old or new business. And in other business, there's three things that I'd like to address. The first being that the 2021 Social Security and SSI cost of living adjustments have been announced. That was October 13th, and that will result in a 1.3% increase effective January for people on Social Security and SSI. That'll average out to be about $20 for the average Social Security retiree. Currently, that's $1,523 a month, the average, and that'll go then to $1,543 a month, and that involves about 46 million retirees across the country. And it's interesting to note that 60% of retirees rely on their Social Security benefit for at least half of their income. So it's a pretty important piece of a person's financial life. The second thing I'd like to address just briefly is the senior care program. That's the prescription drug benefit in Wisconsin. As of the 19th of October, the Department of Health Services is pursuing a amendment to the Wisconsin waiver that would allow for vaccines to be covered in the future. And that would affect 105,000 Wisconsin seniors who have senior care. And it would be administered, those vaccines would be administered through their personal pharmacies and would cover, it's projected to cover influenza, pneumonia, diphtheria, tetanus, pertussis, shingles, meningitis, hepatitis A and B, and then also chickenpox or the varicella zoster. So that's something we'll be following, and hopefully that benefit can be added to the senior care prescription drug plan for Wisconsin seniors. And the final thing is just a reminder regarding the annual Medicare open enrollment. It's on right now and runs through December 7th this year. And a couple of big points to keep in mind is you ought to review your prescription drug and health plans coverage to make sure you have the best possible coverage for next year. Your current plan may result in much higher costs for prescriptions or for health care. And two major things to do. Read that annual notice of change that people should have received about your current plan. It will explain any changes or increases in the monthly premium, charges for higher costs or deductibles. It'll talk about any required access to use only network providers and what providers are included. It'll offer extra benefits such as dental, vision exams, health club memberships, and that sort of thing. And it'll notice any changes in the formulary of covered drugs and talk about any termination of plans or reduced service areas. So it's important to look at that annual notice of change. And the other thing to do is to compare your current plan to other plans available in our area. And you can do that in several ways. First is to look at your Medicare and You publication for 2021. It has a listing of all the Wisconsin plans, both the Medicare Advantage plans and the prescription drug plans. Another thing you could do is to contact the Medigap helpline at 1-800-242-1060 for a free and confidential drug and health plan counseling. Another thing you could do is call Medicare directly. That's at 1-800-633-4227, any day or time. And another possible way to look at would be looking at medicare.gov online and using the Plan Finder tool. And my favorites is to call your Winnebago County ADRC and talk with the Elder Benefits Specialist. And that number is 877-886-2372. So it's important to remember that Medicare is advising that when you compare plans, look at the estimated yearly drug and premium cost. A plan with the lowest premium may not always provide the lowest total cost. So looking at the drug and premium cost is important. Another couple of points, Medicare notes that in 2021, plans have historically low premiums, dropping an average of 34% over the last 3 years, and in some states up to 60%. So keep that in mind. And for 2021, many participating drug plans offer a 30-day supply of insulin for $35 or less. And it's important to know that 1 in 3 people on Medicare have diabetes. And there's no charge to review or switch from your current coverage, and it may save you money and give you better coverage. So be sure to review your annual notice of change and compare your current plans with other plans that are available. So I don't know if Judy is back or not, but are there any questions about any of that? We're just we're needing to wrap it up shortly here. Hearing none, is there a motion for adjournment?
So moved.
Is there a second, please?
I'll second it.
Okay, thank you. And Bobby, Joe, would you call the roll for the adjournment motion?
Ron, I'm not sure it's still on.
Would you repeat, please?
But I'm not sure they're still on.
Oh, okay.
I don't see them.
Okay, I don't see them either now that I'm looking.
We're on.
We're on.
We're here.
Oh, okay.
Sue Ashton. Heidi Beresford-Turkoff.
Yes.
Julie Kiefer.
Yes.
Julie Davids. Ron Durkoff.
Aye.
Judy Ritchie. Adjourned at 9:06 a.m.
Okay, thank you, everyone. We are adjourned.
Thank you, Ron. Mine's totally shut down.
Okay.
Bye.